Lauren, my name's Ophira. I'll be your physiotherapist today. This is Caitlin. She's a grad physio. She'll be listening on the session. Is that all right with you?
Yeah, that's all good.
Great. So what brings you into the clinic today?
Well, I've been noticing recently that in footy, when I go to kick the ball, my right knee starts to give way. It's not painful or anything, but it feels a little weird. I went to my doctor about it, and I got a gait assessment done, and she referred me here to you.
Interesting. Your problem, it kind of reminds me of something that could be with the Q angle.
Oh, the lecture that Simon taught us. Yeah.
Clinical implications and some intervention strategies as well. So essentially the quadriceps angle is a vector force or a line that depicts the angle from the quadriceps muscle right through into the patellar tendon. It is also an important factor for assessing knee joint function with a lot of varying individual cases. This has a specific impact on dynamic tasks such as walking and participating in sport that is important to keep in mind. This also has direct implications on the physical health of the knee joint as well, with the associated physiology, as the increase in quadriceps angle will essentially change the angular momentum that an individual will be placing force through this joint in their body. So moving on here. I'd like to touch on the variations of the quadriceps angle. So there are various anatomical variations, but one of the most important ones I'd like to focus on is sexual dimorphism. So this is essentially the case where females tend to have a greater quadriceps angle due to the wider angle or the wider set pelvis, also with a slightly increased angle of inclination of the femoral head as well. This has direct implications, again, as I said in the previous slide, on dynamic tasks such as walking and participating in sport. But it's also important to note that when you're working with clients of different sex, that it might also have implications on this position of their knee. The normal range for the Q angle should fall somewhere between 13 and 18 degrees. That has been shown through various research studies, with the men at the lower end and the women at the upper end of that range. This range does vary, so keep that in mind as you go through into clinical placement. There has also been shown to be discrepancies with children having a larger Q angle than adults. This is likely due to developing anatomical origins. But for now, I'd like you to focus on the sexual dimorphism and the changes you often see between males and females. So moving on into a little bit of clinical significance, there is typically an inverse relationship between the magnitude of the quadriceps angle and quadriceps strength, essentially noting that a larger quadriceps angle will increase the lateral pull on the patella, which can unfortunately have some negative situations for an individual that is experiencing this. So for example, an individual with an above normal Q angle may likely have, as I said, lower quadriceps strength, but this could also make the individual prone to patellofemoral pain, but also patella displacement as well. So it's important to counteract this with various types of interventions through strength training, for example, and things of that nature, which we'll talk about in a little bit. So in a clinical setting, it's very important to talk about measurement. When an individual comes in to see you, if you are suspecting that their quadriceps angle might be at a greater angle than you would expect for that individual, essentially you'd have the individual lie in a supine position, palpating for their ASIS and their patella. Their patella would be the midpoint or the access point of the goniometer, and you would essentially line up the goniometer between the ASIS and the tibial tuberosity. And then by taking this angle, that will give you essentially what would be known as the quadriceps angle. Research has shown that you could also take this in a dynamic position, but typically it is taken in a supine position to assess their resting value. So as I talked about previously, there is interventions available for a situation such as this through strength training. One of the most important or one of the most popular strength training interventions coming out in the last couple of years has been reactive neuromuscular training. So this is essentially just an opportunity to apply an external force or an external kind of feedback mechanism for the individual as they go through a therapy exercise itself. And essentially what this is doing is it's allowing the individual to maintain in a proper position. So you see here in this bottom picture, this individual, it looks like they're doing a heel drop or a step down, as the therapist holds a band and takes a little bit of tension coming medial to that position of the knee. It requires this individual to place a little bit of more of a lateral force, which actually keeps their knee in line with their leg and strengthens the correct muscles. Oh, question. Yes, Ellie.
Hi, I was just wondering if there were any muscles that resist the lateral forces that are happening at the patella.
Yeah, that's an excellent question. Sorry I didn't touch on that. Great way to apply your knowledge from the previous classes we've had with some of the lower body musculature. But the vastus medialis muscle, the most medial muscle, the quadriceps, is actually going to be one of the most important muscles in an exercise like this, but will also limit or take away some of that lateral pull of the patella itself. So it's very common to see exercises such as this in a therapeutical setting to help strengthen up that portion of the muscle and supply a little bit more stability through that joint, which is where applying a technique such as this can be very important and beneficial.
Lauren, in summary, based on what we discussed today, being a female, you're prone to having a larger Q angle because you have potentially larger hips, and this all relates to the vastus medialis muscle, which is located right here. And so what we're going to do is we're just going to take a few measurements of your Q angle, and we'll do some tests to strengthen as well the vastus medialis muscle. Caitlin, would you mind assessing Lauren's Q angle?
Yeah, absolutely. Would you be okay with that?
Yeah, that's okay.
Awesome. Could I just get you lying on your back then? Okay, Lauren, so what I'm gonna do is just feel for the middle of your patella here and just line up that axis. And then I'm just gonna feel for your ASIS. Perfect. And it looks like your Q angle is about 19 degrees.
Interesting. Okay, that's just slightly above the normal range for a female. I definitely think we should focus on strengthening some of those muscles we talked about earlier.
So Lauren, do you happen to have a staircase in your house?
I do actually, yeah.
Perfect. So what we're going to have you do is to perform a step down exercise. So if you would, could you please place your right foot on the edge of the stair here and come all the way up? And your goal is to touch the ground with that left heel going down as slow as you possibly can. So going down. Oh, okay. And did you see how that left knee was kind of going in a bit?
I did notice that.
Yeah, so that could definitely be attributed to the weakness that you're feeling when you're kicking the footy, and it's kind of increasing that Q angle. So do you happen to have a banister at home as well?
I do, yeah.
Perfect. Okay, so Ophira has a TheraBand.
Yeah, and pretty much you can tie this band to your banister, and what it'll do, just get you to put your foot through here, is it'll, when you do the exercise, it kind of pulls the resistance with your knee inwards, and what you want to do is you want to make sure that you remember to push your knee outwards, and then I'll just activate those muscles and just strengthen it. So if you want to give that a shot. Excellent.
Good. Come back up. Yep.
Nice.
How does that feel?
Much more stable.